All right, today we're jumping right into the thick of it. We're essentially riding along with first responders as they try to solve a medical mystery where the stakes are quite literally life and death. And their only clue? Severe pain. So, picture this. It's 3:20 in the morning. The call comes in for a 79-year-old man with abdominal pain. Now, on the surface, that sounds like a pretty common complaint, right? But as the EMTs are about to find out, this is anything but a routine call. The clock is already ticking. What this patient is experiencing is something doctors call an acute abdomen. Now, that's not a specific diagnosis. Think of it more like an umbrella term for any sudden, really serious problem in the abdomen that's signaling a major internal crisis. It's basically a 5-alarm fire inside the body. So, to even begin to understand what could be going so wrong, we need a map of the territory. Let's take a really quick tour of the human abdomen. You've got to think of the abdomen as this incredibly crowded neighborhood. You've got organs from the digestive system, the genital system, and the urinary system all packed into this one space. And that, right there, is why figuring out abdominal pain can be so incredibly challenging. Now, medically speaking, these organs fall into two very different categories. First, you have your solid organs, things like the liver and spleen. The best way to think of them is like a sponge just soaked with blood. If they get injured, the number one risk is massive bleeding. Then you have the hollow organs, the stomach, intestines, and so on. These are more like water balloons. If they burst, they leak their contents all over the place, which can cause a really dangerous infection. Okay, so with that little map in our minds, let's get back to our patient. The EMTs are now on scene, and their first big job is to decode the clues his body is giving them. And the most important clue of all? The pain itself. So this is what they find. The patient is pale, he's sweaty, he can't get comfortable. He tells them he doesn't have the usual symptoms, like nausea or a fever. But his description of the pain is what really gets their attention. He says it feels like something being pulled apart, and that the pain is shooting straight into his lower back. Those specific words? That's a huge clue. But here's where things can get kind of tricky. Pain isn't always located right where the problem is. There's this phenomenon called referred pain. Because of how our nerves are all wired together, a problem in one organ can actually be felt somewhere completely different. It's like a crossed wire sending a misleading signal. A really classic example of this is gallbladder pain. The gallbladder is in your upper right abdomen, but people often feel the pain in their right shoulder. Why? Because they share some of the same nerve pathways, and the brain gets confused. This is exactly why first responders have to be medical detectives, piecing together all these different clues.
So the EMTs have the patient's story. They've seen his condition. Now they're about to do a physical assessment that is going to change absolutely everything.
And this is it. This is the moment the case breaks wide open. While they're gently feeling the patient's abdomen, they discover a pulsatile mass. What does that mean? It means they can feel a rhythmic pulse, a heartbeat, in a place where there should only be soft tissue. This is the ultimate red flag. A finding like that points to one of the most time-sensitive emergencies in all of medicine, an abdominal aortic aneurysm, or what we call a AAA. See, the aorta is the main highway for blood leaving your heart. An aneurysm is like a dangerous bubble forming on the wall of a worn-out tire. If that bubble tears or bursts, the result is catastrophic internal bleeding. And just like that, all the clues click into place. That severe tearing pain he described as being pulled apart, check. The pain shooting straight into his back, check. The pale, sweaty skin, check. And that pulsatile mass they felt? Well, that's the smoking gun. His symptoms are a perfect textbook match. His vital signs are screaming that there's a crisis. His pulse is racing. It's over 120 as his heart desperately tries to pump blood that just isn't there. His breathing is fast and shallow. And most importantly, his blood pressure is low, which is especially bad for a guy who normally has high blood pressure. His body is in shock. It's losing the battle to keep his organs supplied with blood. So, with a problem this big, there's no magic treatment that can be done in the field. There is only one thing to do, and it has to be done immediately. In a situation like this one, the most important thing an EMT does isn't some complicated procedure. It's recognition. It's about seeing those red flags, understanding just how serious this is, and getting the patient to a surgeon as fast as humanly possible. So their response playbook is actually pretty simple, but every step is absolutely vital. First, they treat for shock, give him high-flow oxygen, keep him warm. Second, they handle him with extreme care. Any rough movement could cause that aneurysm to rupture completely. And third, they transport. No lights and sirens, but a smooth, fast ride to the closest hospital that can do surgery.
And here's the payoff. Because of that quick recognition in the field and that rapid transport, the patient made it to the operating room just in time. The surgeons were able to go in and repair that damaged aorta, and they saved his life.
This case was a huge success, and it really leaves all of us with a critical question to think about. You have to remember those red flags. Severe, sudden, tearing pain, especially if it goes to the back, is not something you ever ignore. Understanding these signs is so important because, as we just saw, recognizing the emergency is the first and maybe the most critical step to surviving it.